Hi, YouTube fam. I am Angeline, the nursing assistant. Today, I'll be talking about questions that people want to know about a nursing assistant. Just common questions that inquisitive people ask about nursing assistant. And it's a lot, you guys. It is a lot. So I will make this a 4-part video. So each Friday for the next 4 weeks will be on this topic. I will come on, ask you some questions, answer some questions that people commonly ask me about nursing assistant. Because if they are wondering, I figured maybe somebody out there is asking the same question. So come on. You know how we do it. Let's get into it. One question that I get a lot is, during the pandemic, what exactly do you do, or what exactly, how did the pandemic affect my job? Did it change it any, or how do you work around it? So that was a big question about it. And yes, it did change. As you know, the older population was very vulnerable to the COVID. So we had to go an extra mile. We had to dress up in gowns, masks, goggles, gloves. And with each patient, we had to pull all this stuff off and go to the next. It was very, very difficult, you guys. We still have precautions in place, but it's nothing like it was when COVID was rapidly spreading. And also, for the family members or whatever, we had to screen each patient. And when they did start letting visitors come in, we also had to screen them, ask them a series of questions, do they temp, and all this kind of stuff. So during COVID, it definitely changed how we worked. And it definitely made it difficult to work with all the safety equipment on. But we had to push through it, and look like we getting up, coming through on the other side. So that was one of the questions. Another question was, what does certified nursing assistant do? And I'm sorry, I'm looking down because I have actually wrote down all the questions that I get. So people want to know exactly what we do. We are the ones that give day-to-day care to our patient. And what I mean about day-to-day care or their ADLs, we bathe the patient, keep their hair clean, change the patient if they're incontinent. We do vital signs with the patient. We turn the patient. We transfer the patient. We even do activities with the patient. So we do day-to-day care with the patient. We also do in and out calf. We do some rehab with the patient, some dressing changes. If they have a decubital ulcer, we would dress that, change that. We do that kind of thing. You know, some places a nursing assistant is medicine. They can get certified to give medicine. So some places they also give medicine. But where I have worked, I have never worked at a place that allowed a nursing assistant to give medicine. But there are some facilities that you will be doing medicine. But our basic thing is ADLs, and that's bath, the day-to-day stuff we take care of. Okay, let me get one more question. Who can, where can I work as a nursing assistant? That's another question that I get a lot. You can work in a nursing home, having a nursing assistant certification. You can work in a hospital. You can work in a doctor's office. You can work in a dentist's office. You can work in a podiatrist's office. You can pretty much work in any health care facility being a nursing assistant. So it's really no limit where you can work at. You got a variety of places that you can work as a nursing assistant. Okay, you guys, I'm going to answer a couple of more questions, and then that will be it for this video, and we'll get into the other question on the next Friday. Okay, the next question is, what are the benefits in being a nursing assistant? There's a lot of benefit in being a nursing assistant, especially if you want to advance your career in being a nurse. Because if you become a nursing assistant first and work as a nursing assistant, your LPN license, when you go to school, will be much easier to become an LPN, because you have worked in the nursing assistant, you have worked as a nursing assistant and got that experience being around doctors, being around other nurses, and you guys, you learn a lot being around and in this environment. I know a lot of nursing assistant is very knowledgeable as much as a nurse. So just being around this type of environment, it really enhances your knowledge, and it will make it much easier if you decide to go back to school to be a LPN, RN, all of that. It will help a whole lot. And also being a nursing assistant, if you want to go in a specific area, you can work in a specific area as a nursing assistant and gain that knowledge in that specific area. So working as a nursing assistant, give you that advantage. And also a nursing assistant, it gives you stability, because there's plenty of jobs out here for a nursing assistant. So you can always find jobs as a nursing assistant, which is a plus. Okay, the next question is say, what age can you become a certified nursing assistant? Okay, most states, you have to be 18 to become a nursing assistant. Some, you got a few states say at 16, you can go and you can be certified as a nursing assistant. Which state that is, I don't know. I didn't do the research on it, you guys. I didn't do the research. But if you're 16 and you're interested in going to school, being a nurse assistant, just Google it. It'll let you know what state, and it'll let you know whether, you're in the right state or not. But 18 is usually the age that you can be able to get certified with no problem. One more question, and it is, can you be a nursing assistant without being certified? Some places allow you to be a nursing assistant without being certified. in a way, I hate saying nursing assistant because you're really not a nursing assistant if you're not certified. But they call them sitters. It's where you can go and sit with a patient when that patient really don't need anything as far as medical or personal care. They really just need somebody to be there. They can't be in the house by themselves. Maybe give them a drink of water, or they can't cook. You have to fix them a little breakfast. You can bring it to them and do that kind of stuff. So some places do hire what they call sitters to do that. But certain stuff that nursing assistant do, they're not supposed to do because they're not certified. So in saying that, yeah, some places do hire nursing assistant under that guideline, but I don't know whether they're really nursing assistant, but they do call them nursing assistant, but they limit in what they can do. And some places will hire you not being certified, but you can only work there 4 months until you get certification. If you don't get certification within that 4 months, then usually they will let you go. So they will work you, but within 4 months, you need to be certified. I hope that answered some of your questions that you had. And like I said, I got so many questions that people ask me. I can't get it all on one video. So we're going to continue this here series for the next 3 weeks on Friday. So that's it for this Friday. If you would, hit that subscribe button, smash that like, and hit that notification bell because you don't want to miss not one of my videos. Not one. Come on. Let's get it started.